Welcome everybody to the GSI Seminar. This week we have Professor David Pencheon. Before I give an introduction, I'd just like to make an announcement about the Waking Up to Planetary Health Emergency webinar series, which is starting tomorrow from 12:30. And this is a series of seminars which will be running each Thursday until Christmas. You can sign up. There'll be an Eventbrite link that I'll post in this chat. But David is one of the co-organisers of that as well. So to introduce David, David is a UK trained doctor and was the founder and director of the Sustainable Development Unit for NHS England. He's currently an honorary professor and an associate here at the medical school at the University of Exeter. And his current role within the department is to understand the role of health professionals and health systems in ensuring a safe, equitable and prosperous planet for all. In 2012, David was awarded an OBE for services to public health and to the NHS. And this year, David was awarded the BMJ's Outstanding Contribution to Health Award. There we go, David, I'll leave the rest to you.
Okay, thank you, Josh. And thanks you and Amy for organising this and inviting me. And yeah, I'll emphasise the planetary health series, which I think is open to everybody. I think it's not just an Exeter phenomenon. But do sort of Google it and find out how you can join any or all of them. And Tim Malone is probably on this call. I'm pretty sure he is. And he will be delighted. He's done all the hard graft in organising them and with collaboration of GSI. Anyway, I'm going to just tell you a few stories. And I'm going to whiz through these fairly quickly because I guess that most of you are somewhat au fait with the role of health and healthcare professionals, and I'm going to try and address three questions, and if you have any thoughts or comments, just put them on a scrap of paper or in the text box, chat box, and I think Josh and Amy will sort of facilitate some toing and froing and hold my feet to the fire in a few minutes after I've been through the slides. So the first question I thought would be useful to pose is, and which has bothered me for a long time, is what is the role of a large public sector, public good organisation in addressing the climate and ecological crisis? Oh, so what should places like the NHS or indeed universities do, not just in teaching or researching or treating sick people, but in terms of their role as wider corporate citizens? Secondly, and more specifically, how can the framing by example set or learning from or framing from the health system be best used to improve health and equity for everybody? And thirdly, actually, what have we learned so far in terms of the past 15, 20 years in terms of large public sector organisations? So just if you don't know, the Sustainable Development Unit for the NHS and Public Health England was a sort of small unit and a device for turning pockets of interest and concern into communities of practice within the health service, into social movements, and we hope into professional and even social renorming of habits and behaviours and what have you, and then trying to seal them with regulatory frameworks and hopefully creating the conditions for survival. So that's a weird way of describing it, but that's essentially looking back over the first 10 years or so of the organisation, what it did. It's a very small catalytic unit. All 99% of the hard graft has been done by people at the coal face in the health service around addressing ecological collapse. But we have a role in linking up people, trying to influence policy formally to allow people to do that. So this is a slide I often use. This is really actually for health professionals to remind people that although we think the health and care system has a usually beneficial effect on health, we hope, climate change has a nasty effect on health, but it also has a nasty effect on the health and care system in terms of making it more difficult to run. But the last loop is actually that the health and care system is actually quite a large contributor to climate change. Most healthcare systems in most countries in the world contribute about 5 or 6% to the greenhouse gas load of that country. And that's not the only relationship, but you've got to remember that health and care systems can easily do harm as well as good. And the traditional triple bottom line, which we often use, all sectors use really, in terms of environmental, social and financial sustainability, is often portrayed like that, where the sweet spot is health and well-being. And I would contend that actually in the health service, there are so many health co-benefits for behaving ecologically responsibly, that central overlapping spot in the middle is large. In fact, we should probably draw the triple bottom line a bit more like that, actually, to remind us that actually everything depends on the natural and physical environment, and the social environment is part of that. And actually, the economic environment is something we create as rules. So I'll just put that to one side, but it's worthwhile remembering that. And so the first thing we found over the first 10 years is that actually a lot of the technology and science around the climate crisis is fairly clear, actually. A 10-year-old could tell you, a 10-year-old school could tell you what the climate crisis is essentially about. It would take you a 20-year-old to, you know, a university undergrad to tell you what most of the solutions are, and they're not that complex. It would take a Nobel Prize winner to engage us all in a clear, straightforward, fair journey to a sustainable future. So it's often about ensuring that we're doing this together that matters. So when we started, the NHS England slogan was high quality care for all, and lately it's become that. So at least we have started to become, certainly we profess to be more future focused than we used to be. I mean, one of the issues about health service, us in the health service, is we're not that interested in health. We're fascinated by illness, but we don't do health that much. And health and illness are not just opposite ends of a spectrum. It's far more complicated than that. And what we first of all did was we started doing measurements. We started doing very big scopes 1, 2, and 3, whole system footprints, and you can see there roughly that it was up at the 35 million tons per annum. And we need to be right down in the bottom right hand corner. And I only show this diagram to remind us all that this is not a bit of efficiency. This is not a few LED lights and a few bike sheds and what have you. This is about a total transformation of £110 billion medico-industrial complex, which is absolutely critical. Everybody knows the NHS. Most people either work in it or know someone who works in it. It pervades every part of the country, both geographically and culturally and socially. So this is not one big isolated factory sitting somewhere. This is a massive concern. And one of my contentions is that doing nothing from the health service perspective is very, very dangerous, not just because of the sheer size, but because of the lack of examples we could set. We know a lot where the footprint's coming from. Actually, you can see there that nearly 3/4 of it is actually from buying stuff, as well as significant proportions from things like travel and building energy. We also know in this diagram what proportion of actions we will need. So this is called a wedge analysis. I mean, the top purple wedge is what would happen globally, like decarbonising the grid. The green wedge is what we could do inside the health system, and only we could do. And there's still a gap. So although we've had some moderate successes, there's a hell of a long way to go. And we actually know where it happened. We know where the hot spots are. But addressing just the hot spots is probably not going to be enough. What have we done over the past 10 years? I mean, by we, I mean the health service. I don't mean the SDU, I mean the health service. Well, we have actually reduced our footprint, which is good as far as it goes, but it's by no means enough. We'd have to keep going massively at this rate to stand any chance of meeting the Paris climate agreements. So we've reduced it by about 11%. And that's actually at the same time as increasing healthcare activity. Now, you may think increasing healthcare activity is a good idea, but all healthcare is not it's not an unvarnished good. We ought to be very careful, because healthcare is often done when we fail to prevent something which is eminently preventable. So it's a bit of a shame that politically politicians see more healthcare as a great thing. I mean, in a sense, it would be great if, as most of you on the call will know, that we did a lot more about preventing the preventable. And actually in that time, in those 10 years, we saved about nearly £2 billion, actually. So by we, I mean all the people hard graft at the coalface. And recently, of course, COVID has raised its ugly head. But actually, Simon Stevens, who's the chief executive of the NHS in England, has been very careful. And actually, he's launched the Greener NHS movement this year during the crisis. And he makes a very important point here, which is worth noting, which is that you can have multiple problems and we can multitask, but we should not use COVID as an excuse to put everything else that's both urgent and intimately related to health to one side. We can do two things at once. So the initial lessons for system improvement, bearing in mind that some of you are from GSI here, are that we were very clear on destination, that our role was to make the NHS step up to the mark and be a leader somewhere in decarbonising and all the other things associated with sustainable development. I mean, sustainable development is not just about decarbonisation. That's a very important part of it, but it's not the only part. So be clear on where you're getting to, but don't be over clear on how you get there, because as we can see from things like the plastic waste movement, COVID, there are many triggers for change that we should absolutely not so much jump on a bandwagon, but align ourselves with, so that people can see that many of the existential problems we face are intimately linked, be they biodiversity or waste or pollution or greenhouse gas emissions, or indeed actually threats to democracy. So these are all very, very interlinked. And that's why systems thinking is absolutely essential to making sure we leave a legacy we can be proud of. Certainly within the workforce, the massive workforce of the health service, about 1.3 million people at least, one of the things that has made a big difference is helping people create the space for us all to live our values. So what has been very interesting in the health service is people who are saying, well, I didn't know I was allowed to talk or think about things like pollution or greenhouse gas emissions within the health service. So that was quite an unexpected finding, that actually when you can mobilize staff and give them permission, and that's what makes that announcement by Simon Stevens very important, because it helps mobilize and legitimize and permission action. Being proactive, of course, is very important, if only to promote active hope. Otherwise, people just become very, very depressed if we just talk about the problems. We have to be very, very focused on solutions, even if they seem homeopathic at first instance. I think a lot of people around the system, for instance, people like Tim Malone around Exeter, has been one of the many people who've been engaging and acting collectively. And if it weren't for that sort of collaboration and collective endeavor, you know, I certainly wouldn't be liaising with GSI, I wouldn't know about them, and vice versa. So that's incredibly important to reach out and engaging diverse people, often via diverse entry points. You know, two people might care hugely about this, but they might care about it for different reasons, and that really doesn't matter. You shouldn't start arguing about, you know, my reason is a better reason than your reason. The fact is we all have different points of inflection and influence, and we should align them accordingly. And ultimately, of course, everything is connected, and although it's easy to say thinking and acting in systems, it's tremendously important. So I'll just give you a few examples, and then we'll sort of open it up for some questions and comments. So this is so air pollution is a very, very good entry point, because climate change is scary and weird and to some people rather alien, but air pollution is not. But even if we say there are 40,000 early deaths across the UK per annum attributable to air pollution, even that doesn't have much resonance with some people. It makes a lot of difference if you say it's an average of 8-month loss of life for every person in a big urban area like many parts of London. That has much more political and social power. Go to the other end of the spectrum now, and this is a story about Abu, who works in actually a very moderate-sized city in northern Pakistan, and he's paid a bit of a pittance really in a very dangerous environment, which is making surgical instruments. It's interesting. You learn all sorts of interesting things in this game. 60% of the world's surgical instruments are start their life in this one city, which is also famous for making about half the world's leather footballs. But Abu stands a pretty good chance of losing a finger or an eye by the time he's grown up. So we're all very familiar with fair trade coffee or fair trade cotton, but we're not always that familiar with fair trade surgical instruments. And so a lot of what happens around the world is invisible to us, and sometimes it is it is all sort of learned ignorance, it's convenient ignorance. But actually we do have the power to and as you saw, that 74% proportion of greenhouse gases were from procurement. We do have the power. We have a approximately 25 billion pound a year procurement budget in the NHS. We should absolutely be doing something about it. This is a colleague, Mahmoud Bhutto, who has done something about this very issue and started an ethical trade group within the health service. So that's rather inspiring. I mean, it's very inspiring, in fact. And it shows that every discipline and every person, every craft and every profession, even within the health and care system, has an important role to play. So let's take another issue, which people within and colleagues of the GSI will be very familiar with, which is global energy. And so this is a well-told story about renewable energy across Europe, and knowing that if you could put renewable energy in the form of CSP or photovoltaics around the Saharan coast there, we can easily supply clean, green, resilient power to Europe, not just now, but for the population in 2050. Now, this is technically not that difficult with a DC supergrid. And the second red square there will show you how much land you need to cover in the Sahara, or certainly on the Saharan coast towards the sea, in order to do that. And of course, it has the huge co-benefit of taking clean, green energy north and money in investment south, which addresses, of course, the global inequity we have, or even just this part of the world, the inequity we have, as well as providing crops and providing desalination for the sea and stopping the deserts getting bigger than they really are. So, and the problem, the reason we don't do this at scale and pace is purely geopolitical. It's not due to the lack of technology or lack of will. It's geopolitical. How does this translate into this country? Well, here's an example in the North Midlands, in the University Hospitals North Midlands, where actually a hospital is let out its roof space in a very novel business model, but very workable and simple, with a community-owned raising of shares, but with a third party, a fuel poverty charity. It raises a moderate amount of interest for staff and local community who choose to buy shares, but it also raises money for fuel poverty, and it also is very good part of the hospital's mission of improving health, not just addressing illness, and it addresses those 8 sustainable development goals at least. So here's a hospital in the north of England. You can tell it's a hospital because if you look carefully, or not so carefully, you can see a big chimney and a car park. Now, that was not fit for purpose. So there's the new hospital, smaller, cleaner, greener, cheaper, much more friendly, much healthier, good working conditions, a big community asset with a lot of outreach services. But what's impressive, of course, is what they did to the old hospital, which is to take it away, which we're not always good at stopping. We're quite good at starting things in the NHS, but we're not quite as good at stopping things. So the infrastructure of the hospitals and the hospital system, although only a small amount of healthcare is actually delivered in hospitals, it is quite expensive and intensive and very smart and very important. But actually, we do need to decarbonize the infrastructure, and this is one of the ways of doing it. Just finally, here's a very good example of how hospitals can act not just as huge buildings, but as anchor organizations. This hospital in Nottingham, the colleague of mine here, John Hughes, when he worked there as deputy catering manager, actually revolutionized the food economy in Nottinghamshire by going out to local farmers and saying, we want to develop relationships with you for you to provide fresh, local, often organic, healthy food, which not only served our patients and our staff well, but actually provided local jobs, cut down food miles, and it crucially brought people into employment in the hospital as they reopened the kitchens who wouldn't have been in, who would have found it very difficult to get into employment. And he gave them the first leg into an employment ladder and promoted them into the food sector elsewhere in Nottinghamshire. This is a really, really important story. It was well quantified, it was well evaluated. And the tragedy in the health service, of course, is that we can't replicate these things as quickly as we should do. You know, the NHS is the biggest buyer of food in the country, and a lot of food we buy is shipped overnight in cooked chill plastic containers from another country. You know, it's shocking, really. So there's a very good example of how the future is already arriving, but just unevenly distributed. Now, just finally, I'm always intrigued about messaging and about how we can make this thing both alive and sometimes even humorous. And by humor, I don't mean belittling and trivializing an issue. I mean engaging people with messaging like this, or you're probably very familiar with messaging like that. I mean, these go cut to the core of what's very important about having an emotional engagement with this issue. And finally, not breaking the law is very important. So we all know about the Climate Change Act 2008, which has been very influential in this country. But we have the Public Services Social Value Act in 2012, where authorities like hospital trusts are legally obliged to consider how they procure might just improve the economic, social, and environmental well-being of the relevant area. Now, this is very important because a lot of organizations cry foul that their first responsibility is what is called the fiduciary responsibility of staying solvent. And we've got to move people into this triple bottom line approach. And the same is true in Wales. I mean, Wales have got some very inspiring legislation, which they're struggling to make best use of in terms of the Wellbeing of Future Generations Act. So in summary, in a complex adaptive system, not just like the planet, but like the health service, which is for many reasons an important microcosm of the world we live in. These are the sorts of, this is a very simplified map of the approaches to large system change in a complex. You know, probably the most important thing is to do what we're trying to do to each other now, which is convening and listening and engaging people. And sharing real facts, but also real stories about the way the world could be operating, examples of which are already operating by demonstrating current actions. Crucially, you know, one of the definitions of innovation is to take barriers, real or perceived, out of the way to make action allowable. That's permissioning it, easy, natural, and desirable, so making it fashionable as well. Reframing it, and we've just had a few examples of how you can reframe things to engage people who are looking for different benefits, who have different values, but are aligned on a common journey. And then scale and pace, making it normal, so you expect people to do it. Not necessarily legislating the first instance, but making it, but sometimes actually making it unacceptable and shameful not to do it. And finally, you may want to make it compulsory, not just to kickstart a movement, but to actually to seal change as it's happened, because there are plenty of examples of good things happening which go backwards when people take their eye off the ball or the legislation changes. One example of that is when Obama took the Paris Climate Agreement back to the United States and sealed it in the United States by presidential decree rather than taking it to Congress. If he'd taken it to Congress, it wouldn't have been able to be undone by presidential decree. It's a long, complex story, but don't forget that things can go backwards. And just remember that for many areas, it's much easier to act your way into a new way of thinking than to think your way into a new way of acting. And I say that the reason that has particular resonance here is because a lot of us on this call are probably scientists who probably like to get all the facts right before we move forward. And the reality of change is often that we find ourselves doing things differently because it becomes normal to do things differently. And then we post hoc rationalize that and understand the evidence that therefore fits with our current action. So it's a very important principle. So I'm going to stop there. I don't know how long that's, I think we've got plenty of time, Josh. So I'll stop, and I'm very happy to pick up on comments and questions, and my email's on the screen there at Exeter. So do feel free to come back to me if you have to dash off now by email.